So I was the person that was on call that night, and I got a phone call from the emergency department resident that was working in the trauma bay that night, which is not usually what happens. Usually we'll get a page, and she told me that there were going to be 20 plus gunshot wound patients coming in. And so I went downstairs, and basically they started coming in, and one after another, and it doesn't take long to realize that this is something different. We'll see 2 to 3, sometimes up to 4 to 5 patients, at one time, commonly. But this was totally different because the potential for the need for operative intervention with somebody who's shot is much higher. Well, a nurse from Los Angeles sent me a letter, and she had been involved in 1984 Olympics. There was a person that drove a car through a crowd of people, and she pointed it out really well. She said that the training that we have done doesn't totally prepare you for what's happening, but like a play, it gets you to your point on stage. Okay, so you have a good starting point, and you have supplies in order. You have people that have gone through the motions of at least practicing where patients are going to go, who's going to do what, etc. It doesn't totally prepare you, but it gets you a good starting point, if you will. Clinically, I don't think so. Probably what we wish we would have known was how to deal with the volume of families that were going to be impacted, because as Holly said, we were dealing with families that were patients of patients, and then families of victims that never even made it to our hospital.
When hospitals drill for disasters, they typically focus on the emergency department, and they focus on how they would bring patients into the emergency department, and perhaps how they would then move patients up to an operating room or to the floor. And then they stop the drill. And that, in a disaster situation, that type of intake is over in a matter of hours at most. And as Chad mentioned, it's everything after that hospitals really need to be focusing on, because for us, it was, as he said, it was the families. Well, before the Pulse event, I would have said probably yes, based on our experience. We've been preparing quite vigorously for a disaster event because of all the hurricanes that we have and the tornadoes here in Florida. The propensity perhaps for a terrorist event at one of the amusement parks. That's what we would have expected. But we've been preparing for something like that for years. So yes, I would have assumed that other trauma centers would have been doing the same. What we have found, though, as I mentioned, is many hospitals and even trauma centers that say, well, we don't have a plan. Should we have one? Yes. Every hospital needs to have a plan.
I would say, obviously, we talked about planning, but the culture of teamwork is imperative. Enabling your frontline staff to feel comfortable making decisions on their own and supporting them, empowering them to do what needs to be done without having to check with their charge nurse or check with, their boss, is really not only team members working together, but enabling them to make decisions on the fly, I think is imperative. So embracing a culture of team member empowerment is key.